Hey, what's up, everybody? John Millen here. Hey, I want to talk about a topic that has affected a lot of people, I'm sure, especially if you're in the employee benefits or HR, you own a company, you have employees, you probably dealt with some kind of addiction at some point with your employees or family members, whether it's alcohol or opioids, meth, crack, cocaine, and now all kinds of new stuff, fentanyl, all kinds of stuff that's hitting the market. I wanted to share something that most people don't know about that can be game-changing for employees at companies. Did you know that you can, in certain situations, create a benefit plan, a health care plan that has coverage for any kind of addiction treatment and support system? The challenge right now, and I was just at a great organization yesterday called McShin Foundation in Richmond. John Shinholzer is the owner. He and his wife started the company in 2004. The organization, it's a nonprofit. You should check them out, mcshinfoundation.org. But they're doing some great work helping people in the community. And one of the challenges they have is the funding to help people. Now, they have a sliding scale. You know, they can take Medicaid and they can help things. But what do you do if it's an employee of your company that maybe makes good income but can't afford the treatment of the services because it's not covered by insurance? This is a hole that I've seen, and I'm trying to fill it over the last couple of years by doing something called a custom health plan. And essentially, it's not going to work for every company. You have to probably have at least 40 employees on your medical plan, ish, 40 or above, somewhere in that range. It's, you know, we can probably work under, but some of the tools we have available don't work for like companies that have 10 employees on medical, unfortunately, yet. But what we can do is we can build in the coverage. We can custom build recovery and treatment coverage in the medical plan, so the medical plan pays for it. So some of these recovery programs can be weeks and weeks and weeks and weeks of treatments, and it can be very expensive. And so if you'd like more information, just reach out to us. If you're an employer and you're like, hey, that would be great. One thing you're gonna find is if someone needs treatment, the insurance can be the biggest roadblock. And it's surprising because it shouldn't be, but it is. The whole system is having an issue trying to struggle with this whole thing. If you remember mental health parity, right? That just became law recently, but yet it was supposed to be law years ago where you paid the same amount for a mental health visit than you did a PCP. Look how long that took. That's just getting an appointment for a copay, right? Getting the same cost to go see a mental health provider. Now, you're talking about treatment and recovery and everything else. It could be thousands of dollars that your health care plan can pay for. Why would you do that? Because if you have good people working for you that have got addicted to drugs, it's probably not their fault. The drug took over, hijacked their brain, and the more you learn about addiction, how it works, it's not their fault. And so you have this good person that's been affected by this, and they want to get treatment, and then they find out, oh, it's going to be $3,000 out of pocket. And let's face it, even though it's worth it for most people, people don't have an extra $3,000 laying around, and so they don't do it. So if you want some more information about how to build a custom health plan, again, you build the mental health, the addiction, the recovery, the substance abuse, whatever you want, you build it custom. You say exactly what you want. And you can't do this with a fully insured plan. You can't do this with what's called a retail plan. So even if you had like a level funded plan from Anthem, UHC, Cigna, Aetna, you can't do that. It's got to be a wholesale custom plan. It's not too scary. If you want to learn more, let me know.